Skin cancer, the unusual development of skin cells, regularly creates on skin presented to the sun. Be that as it may, this regular type of cancer can likewise happen on spaces of your skin not usually presented to daylight. There are three significant sorts of skin cancer: basal cell carcinoma, squamous cell carcinoma and melanoma. You can decrease your danger of skin cancer by restricting or keeping away from openness to bright, UV radiation. Checking your skin for dubious changes can help distinguish skin cancer at its soonest organizes. Early identification of skin cancer allows you the best opportunity for fruitful skin cancer therapy. Skin cancer care at Mayo Clinic. Side effects. Where skin cancer creates. Skin cancer grows fundamentally on spaces of sun-uncovered skin, including the scalp, face, lips, ears, neck, chest, arms and hands, and on the legs in ladies. Yet, it can likewise frame on territories that infrequently come around: your palms, underneath your fingernails or toenails, and your genital region. Skin cancer influences individuals of all skin tones, incorporating those with hazier compositions. At the point when melanoma happens in individuals with brown complexion tones, it's bound to happen in territories not regularly presented to the sun, like the palms of the hands and bottoms of the feet. Basal cell carcinoma signs and indications. Basal cell carcinoma as a rule happens in sun-uncovered spaces of your body, like your neck or face. Basal cell carcinoma may show up as a magnificent or waxy knock, a level, tissue-hued or earthy-colored scar-like sore, a draining or scabbing sore that mends and returns. Squamous cell carcinoma signs and indications. Regularly, squamous cell carcinoma happens on sun-uncovered spaces of your body, like your face, ears and hands. Individuals with hazier skin are bound to create squamous cell carcinoma on territories that aren't regularly presented to the sun. Squamous cell carcinoma may show up as a firm, red knob, a level sore with a textured, crusted surface. Melanoma signs and side effects. Melanoma can grow any place on your body, in any case typical skin or in a current mole that gets cancerous. Melanoma frequently shows up on the face or the storage compartment of influenced men. In ladies, this sort of cancer regularly creates on the lower legs. In the two people, melanoma can happen on skin that hasn't been presented to the sun. Melanoma can influence individuals of any skin tone. In individuals with more obscure skin tones, melanoma will in general happen on the palms or soles, or under the fingernails or toenails. Melanoma signs include an enormous earthy spot with more obscure dots, a mole that adjustments of shading, size or believe or that drains, a little injury with an unpredictable boundary and bits that seem red, pink, white, blue or blue dark, an agonizing sore that tingles or consumes, dim sores on your palms, soles, fingertips or toes, or on mucus films coating your mouth, nose, vagina or rear end. Signs and manifestations of more uncommon skin cancers. Other, more uncommon kinds of skin cancer include Kaposi sarcoma. This uncommon type of skin cancer creates in the skin's veins and causes red or purple patches on the skin or mucus films. Kaposi sarcoma chiefly happens in individuals with debilitated safe frameworks, like individuals with AIDS, and in individuals taking meds that smother their common insusceptibility, for example, individuals who've gone through organ transfers. Others with an expanded danger of Kaposi sarcoma incorporate youngsters living in Africa or more established men of Italian or Eastern European Jewish legacy. Merkel cell carcinoma. Merkel cell carcinoma causes firm, gleaming knobs that happen on or just underneath the skin and in hair follicles. Merkel cell carcinoma is regularly found on the head, neck and trunk. Sebaceous organ carcinoma. This exceptional and forceful cancer starts in the oil organs in the skin. Sebaceous organ carcinomas, which normally show up as hard, effortless knobs, can grow anyplace. However, most happen on the eyelid, where they're regularly confused with other eyelid issues. When to see a specialist. Make a meeting with your primary care physician in the event that you notice any progressions to your skin that stress you. Not all skin changes are brought about by skin cancer. Your primary care physician will research your skin changes to decide a reason. Causes. Skin cancer happens when blunders, changes, happen in the DNA of skin cells. The transformations cause the cells to outgrow control and structure a mass of cancer cells. Cells associated with skin cancer. Skin cancer starts in your skin's top layer, the epidermis. The epidermis is a flimsy layer that gives a defensive front of skin cells that your body consistently sheds. The epidermis contains three principal kinds of cells. Squamous cells lie just beneath the external surface in capacity as the skin's inward covering. Basal cells, which produce new skin cells, sit underneath the squamous cells. Melanocytes, which produce melanin, the shade that gives skin its typical shading, are situated in the lower part of your epidermis. Melanocytes produce more melanin when you're in the sun to help secure the more profound layers of your skin. Where your skin cancer starts decides its sort and your therapy choices. Bright light and other expected causes. A significant part of the harm to DNA in skin cells results from bright, UV, radiation found in daylight and in the lights utilized in tanning beds. In any case, sun openness doesn't clarify skin cancers that create on skin not usually presented to daylight. This shows that different elements may add to your danger of skin cancer, for example, being presented to harmful substances or having a condition that debilitates your insusceptible framework. Risk factors. Variables that may expand your danger of skin cancer include light complexion. Anybody, paying little heed to skin tone, can get skin cancer. Notwithstanding, having less shade, melanin, in your skin gives less security from harming UV radiation. In the event that you have fair or red hair and light-hued eyes, and you spot or burn from the sun effectively, you're substantially more liable to foster skin cancer than as an individual with hazier skin. A past filled with burns from the sun. Having had at least one rankling burns from the sun as a kid or teen builds your danger of creating skin cancer as a grown-up. Burns from the sun in adulthood additionally are a danger factor. Extreme sun openness. Any individual who invests significant energy in the sun may foster skin cancer, particularly if the skin isn't secured by sunscreen or apparel. Tanning, including openness to tanning lights and beds, likewise puts you in danger. A tan is your skin's physical issue reaction to unreasonable UV radiation. Radiant or high-height environments. Individuals who live in bright, warm environments are presented to more daylight than are individuals who live in colder environments. Living at higher heights, where the daylight is most grounded, likewise opens you to more radiation. Moles. Individuals who have numerous moles or strange moles called dysplastic nevi are at expanded danger of skin cancer. These unusual moles, which look unpredictable and are for the most part bigger than typical moles, are more probable than others to get cancerous. On the off chance that you have a past filled with strange moles, watch them routinely for changes. Precancerous skin sores. Having skin injuries known as actinic keratoses can expand your danger of creating skin cancer. These precancerous skin developments regularly show up as unpleasant, textured patches that range in shading from earthy colored to dim pink. They're generally basic on the face, head and hands of lighter-looking individuals whose skin has been sun-harmed. A family background of skin cancer. On the off chance that one of your folks or a kin has had skin cancer, you may have an expanded danger of the illness. An individual history of skin cancer. On the off chance that you created skin cancer once, you're in danger of creating it once more. A debilitated invulnerable framework. Individuals with debilitated insusceptible frameworks have a more serious danger of creating skin cancer. This incorporates individuals living with HIV/AIDS and those taking immunosuppressant drugs after an organ relocate. Openness to radiation. Individuals who got radiation therapy for skin conditions, for example, dermatitis and skin breakout, may have an expanded danger of skin cancer, especially basal cell carcinoma. Openness to specific substances. Openness to specific substances, like arsenic, may expand your danger of skin cancer. Avoidance. Most skin cancers are preventable. To secure yourself, follow these skin cancer avoidance tips. Stay away from the sun during the center of the day. For some individuals in North America, the sun's beams are most grounded between around 10 a.m. Furthermore, 4 p.m. timetable open-air exercises for different times, even in winter or when the sky is shady. You retain UV radiation all year, and mists offer little security from harming beams. Staying away from the sun at its most grounded assists you with staying away from the burns from the sun and suntans that cause skin harm and increment your danger of creating skin cancer. Sun openness amassed over the long run additionally may cause skin cancer. Wear sunscreen all year. Sunscreens don't sift through all destructive UV radiation, particularly the radiation that can prompt melanoma. Be that as it may, they assume a significant part in a general sun insurance program. Utilize a wide-range sunscreen with a SPF of in any event 30, even on overcast days. Apply sunscreen liberally, and reapply at regular intervals, or all the more frequently in case you're swimming or sweating. Utilize a liberal measure of sunscreen on completely uncovered skin, including your lips, the tips of your ears, and the backs of your hands and neck. Wear defensive garments. Sunscreens don't give total insurance from UV beams. So cover your skin with dim, firmly woven garments that covers your arms and legs, and an expansive overflowed cap, which gives more insurance than a baseball cap or visor does. A few organizations additionally sell photoprotective dress. A dermatologist can suggest a proper brand. Remember shades. Search for those that square the two kinds of UV radiation, UVA and UVB beams. Try not to tan beds. Lights utilized in tanning beds discharge UV beams and can expand your danger with the assistance of mirrors. Check your face, neck, ears and scalp. Look at your chest and trunk, and the tops and undersides of your arms and hands. Look at both the front and back of your legs, and your feet, including the bottoms and the spaces between your toes. Likewise check your genital territory and between your bum.